Hormone Optimization Therapy, HOT, is essential in preventive medicine. In this video, I'll explain the difference between normal and optimal hormonal levels. Nowadays, in our Western world, our medicine is all about sick care. Most doctors do not give any preventive advice. They just wait till people get sick, come in, and they get prescribed pharmaceutical drugs to treat the disease. In preventive and lifestyle medicine, we believe we need a paradigm shift from disease management to a true healthcare and wellness type approach. Preventive medicine is all about hormone optimization. Probably you're already familiar with the next abbreviations: TRT, Testosterone Replacement Therapy, HRT, Hormone Replacement Therapy, and TOT, Testosterone Optimization Therapy. But since these abbreviations all hint towards the replacement or optimization of male and or female sex hormones, testosterone, estrogen and progesterone, I prefer the abbreviation HOT, which stands for Hormone Optimization Therapy. And here is the essence of Hormone Optimization Therapy: the difference between normal and optimal hormonal levels. Let me explain. Almost no one on the forums concerning testosterone replacement therapy meet the criteria for TRT because they have so-called normal levels. And then again, you hear a lot of people state, I don't need to supplement with pregnenolone or DHEA since my levels are in the normal range. When we're talking about hormone optimization, we're talking about these six: testosterone, thyroid, DHEA, pregnenolone, melatonin and vitamin D3. Each individual hormone has its own individual protective and beneficial properties. Now, no different than testosterone, do you want to be in the normal or low normal range, or do you want to be in the optimal range? Melatonin has great anti-cancer properties. Do you want a little cancer prevention or a lot? If you want a little, well, don't supplement. Pregnenolone has positive effects on memory, so do you want a little improvement or a lot? DHEA has numerous positive effects. DHEA decreases visceral fat, stimulates the immune system, decreases cholesterol, increases energy, has antidepressant properties and many more. So, do we want a little of this or a lot of this? Do we want our DHEA to be in the low or middle of the range, so we get a little or some of the benefits? Or do we want it to be in the higher end of the range to maximize all of the DHEA benefits? Repeatedly, I hear people say on forums, you don't need to supplement pregnenolone or DHEA if your levels are normal, but they are on TRT with normal levels and get cross when doctors won't prescribe them testosterone when symptomatic and having normal levels. It's a total lack of understanding of what optimization hormones is. It's putting all the beneficial hormones at the upper end of normal for a young person to obtain the beneficial qualities of each hormone. There are only two feel-good hormones, and these are thyroid and testosterone. If you are deficient in those, you will know it. You can be deficient in DHEA, melatonin, pregnenolone and vitamin D3 and never really know it. Optimization of hormones is supplementing to obtain the maximal benefits of each hormone. So where do you want your testosterone, thyroid, DHEA, pregnenolone, melatonin and vitamin D3 to be? Normal or optimal? For me, my patients and my family, I choose optimal. Each individual hormone has individual beneficial effects and you should all want to maximize those benefits. And the only way to do that is to supplement them no different than you do testosterone. Thank you for watching till the end. If you want more information on how to optimize your hormones in the most efficient way, make sure to subscribe to the channel and click on that notification bell so you're always getting the most recent updates from the specialists in the field of HOT.